So welcome, everyone. We are delighted to have you here today to talk about Designathons. What are they? How can they be used in health? We have an exceptional team who are presenting from all over the globe today. And our first speaker is from South Africa, Dr. Beatrice. Dr. Halpap is a co-founder and lead of SIHI, the Social Innovation in Health Initiative at TDR, the special program for research and training in tropical diseases, co-sponsored by UNDP, UNICEF, the World Bank, and the WHO. Dr. Halpap was previously the head of the TDR program management, several leadership roles within TDR. In 2014, she launched SIHI, focusing on cultivating social innovation in health in low and middle income countries. Social innovation is a community-engaged process that impacts health and social outcomes, drawing on the diverse strength of individuals. So thank you so much for joining us, Dr. Halpap, and we'll turn it over to you.
Good morning, good afternoon to everyone. It is a great pleasure today to welcome you on the behalf of TDR to this Designathons webinar. Thank you, Joe. Thank you, all co-organizers. I would like to introduce the SIHI, the Social Innovation in Health Initiatives, discuss Designathons, and reflect on why TDR is interested in this topic. So first, SIHI is the Social Innovation in Health Initiatives. It's a group of researchers, innovators, youth government leaders, community members, and other stakeholders who are advancing social innovation through research, building capacity, and advocacy. This way, we are aiming to enhance healthcare delivery, and universal health coverage. SIHI was developed with TDR and now has an independent secretariat at the University of the Philippines, Manila. Today, there are 13 hubs, mostly in low and middle income countries all over the continents. One major part of social innovation is community engagement. We need innovative methods to bring together people and collaboratively develop new health services. Designathons are one way to do exactly that. A Designathons is a 3-stage participatory activity informed by design thinking. It includes preparation with end users, an intensive period of collaborative teamwork, and follow-up activities for implementation and research. Designathons are community-engaged process that can be used to identify social innovation, develop health intervention, and achieve consensus. Designathons are within a broader umbrella of crowdsourcing. In partnership with TDR, SIHI, and SESH, a team developed a practical guide on crowdsourcing in health and health research in 2018. Over the past 5 years, we have seen many more Designathons, and COVID-19 accelerated the development of online and hybrid Designathons, creating new ways to engage community and inspire change. And finally, I would like to explain why TDR is so interested in Designathons. First, TDR is serious about enhancing accountability to stakeholder beneficiaries, partners, and resource contributors. And Designathons provide a way for local people, especially end users, to play a key leadership role in developing new health services and take their health into their hands. Second, TDR's social innovation in health initiatives require fresh and innovative methods, approach, and ideas. And these Designathons, the approach of them, can help to spur innovation and thinking outside the box. And third, the TDR is committed to strong community engagement in health research, building upon its long and historic path on community engagement research. The Designathons provide a framework for enhancing public engagement amongst diverse community stakeholders. Finally, TDR is embedded within the WHO and plays a normative role in making guides and guidelines on health research. A TDR practical guide on Designathons would be useful to help best practices and increase the rigor of subsequent research. Thanks to the SIHI, SESH, and HOP for organizing this event. Now, I'm happy to turn things over to Nita and Yusuf.
Hello everyone, I am Yusuf Babatunde, a pharmacy student at the University of Ilorin here in Nigeria. I am also a research assistant at the Nigeria Institute of Medical Research, where I am implementing a prep project, which interestingly was from a Designathon in 2022. At my right-hand side, you would see a picture from the Designathon for HIV self-testing among youth in Nigeria, organized by For It By It in 2019. I have participated in the Designathon, I have organized one, and I am privileged to be introducing one to you today. So what basically is a Designathon? So a Designathon can be considered as a 3-stage activity that is informed by design thinking, that includes preparation with the end users, an intensive period of collaborative teamwork, and lastly, follow-up activities for further implementation and further research. Designathons have been called hackathons, hackfairs, innovation challenges, and that's because they usually resemble hackathons. Hackathons are mostly focused on tech, and Designathons can either be tech and non-tech. To elaborate more on the structure, the first stage involves preparing with the end users, and this is when we organize an open call to either identify for exceptional people or to identify exceptional ideas from people. Then we bring together teams to further prepare for the event. And it's also very essential to promote the open call so as to engage the community to contribute and also set expectations for the designathon. After we've identified either the people or the ideas, they will move on to the next phase, which involves either an in-person, online, or a hybrid collaborative team event ranging from 2 hours to 72 hours, where we also invite expert mentors to provide further guidance and support on their ideas. And also, there'll be a judging system, and it will end with a prize-based award system. Lastly, there's usually a need to follow up with the event. It could be in form of a boot camp or just a follow-up activities that will be more intensive in terms of capacity building, a second phase of iteration, and more research in terms of implementation to equip the participants with further skills to enable them to further implement their ideas. Thank you so much. I'll now hand over to Nitha to talk about the framework of a designathon and the benefit of a designathon.
Thank you, Yusuf. Hi everyone, my name is Florita Tiasapen, or you can call me Nitha. I'm a PhD candidate at Central Clinical School, Monash University, Australia. In terms of my experience with Designathon, I've organized a Designathon called Let's Get Prepared Designathon last April. And we asked the participants to develop solution packages to increase the awareness and uptake of pre-exposure prophylaxis for HIV among Asian-born men who have sex with men in Australia. So the Designathon went well, and we are now in the stage of implementing the finalist solution in a clinical trial to measure its effectiveness. So that's all about myself. Now let's move to the conceptual framework for Designathons. So Designathons are underneath the larger categories of crowdsourcing. Researchers who organize Designathons may be interested to use human-centered design approaches to identify the community and engage them in the planning, implementation, and evaluations of Designathon. Why would we organize Designathon? There are several benefits. Firstly, you can reduce disparities if you get the end user involved and engaged, not as only participants, but also as a leader, and this could improve the process and outcomes. It can be fun activities where you can gain knowledge at the same time. It can promote personal growth and self-development. You can learn skills from the mentors or exchange your opinion with other professionals. It can also enhance multidisciplinary collaborations. You may be working with doctors, engineers, or designers in Designathons. And lastly, it leverages networks. You can expand your connections. So these are benefits of Designathon. So that's all from my part. The next talk will be about the participatory process by Dr. Rainer Tan. Thank you.
Hi everyone, good morning, good afternoon, good evening. My name is Dr. Rainer Tan from the Social Entrepreneurship to Spur Health, and today I'll be telling you a little bit more about our participatory journey that we have had in terms of developing this Designathon practical guide. And over here you actually see a picture of the SESH team at our own Designathon. We thought it would be a very fun addition to the presentation. So in terms of developing the Designathon practical guide, we utilize an open call format for submissions to really get more submissions on what people are doing in terms of best practices and experiences for Designathons around the world. And with an open call for submissions, we follow a standardized and published approach that involves 6 stages. And this was published as a practical guide with the WHO, TDR, and SIHI. You can see the 6 stages here, starting from selecting a crowdsourcing, then organizing a steering committee, engaging communities to contribute, receiving and evaluating contributions, recognizing finalists, and then sharing solutions and implementing them. So the purpose of this Designathon Practical Guide open call was to gather best practices and practical tips relating to Designathons for health. And how we managed to get submissions was engaging partner organizations, whose beneficiaries were involved in Designathons and similar activities, and getting them to submit their ideas to us. We also sent direct emails to existing health Designathon organizers that we identified through a search online, and also to authors of Designathon related journal articles. So a total of 43 submissions were received by the end of the open call, of which 26 were eligible for judging. So this is the timeline for the open call. So we had our first steering committee meeting in December 2022, where we decided a lot of the strategic portions and the timeline for this entire process. And then we launched the open call in January 2023. And the open call was open all the way till the end of February 2023. And we had a judging phase from March to April 2023. Thereafter, we notified finalists in terms of those top scoring submissions in end April. So the open call, we encourage folks to submit to 3 different categories or 3 different themes. The first one, we were looking at process evaluation or description of a Designathon. So this involved having descriptions or an evaluation of a process or segment that was part of a Designathon. The second category or theme was a strategy to organize a Designathon. So this would be descriptions and or evaluations of a particular strategy used to organize your Designathon. And the third theme or category was an outcome evaluation. So this involved a description and or evaluation of the outcomes of a particular Designathon. And you notice that these number of submissions don't add up to 26 because some submissions and descriptions involve covering multiple themes or categories. So this judging rubric over here was used to evaluate the submissions, and it was developed by the steering committee, which involved domain experts, community members, and so on. And this involved relevance to the open call as the first rubric. Secondly, clear and concise description. Third, in terms of impact, so this is the effectiveness, quality, or influence that a particular idea or description might have on future Designathons in health. Fourth, we will be having feasibility and scalability. So feasibility means that your Designathon is organized in a way that is realistic and practical for a given context. And scalability refers to how Designathons could be replicable in other contexts. And the last one will be a promotion of equity. So it's addressing inequities in the design, implementation, or evaluation of Designathons. In terms of the submissions, we saw submissions from around the world in low to middle income contexts, as well as high income contexts. And we actually saw, in terms of the scores, pretty high quality submissions. Most submissions were on this right side of this histogram. But as with all open calls, we would recognize, evaluate, the top scoring submissions. And these are the top scoring submissions from our open call for the Designathon Practical Guide. And I won't say much about them because they are here today. We're privileged to have them join us, and you will be hearing a lot more from these folks over here about their respective submissions. And that's all from me. Thank you very much, and I thank the SESH team for the opportunity to present today. All right, and now we'll move on to Dr. Jason Ong, who will tell us a little bit more about the systematic review that we did on Designathons for health. Dr. Jason, over to you.
Hi everyone, my name is Jason. I'm a sexual health physician and a health economist based in Melbourne, Australia. It's a real pleasure for me to share with you a systematic review on Designathons. I'd like to firstly acknowledge my wonderful collaborators, which you can see on the screen here, and also thank the organizations SESH, Project Hope, and SIHI, I think that's how you pronounce it, and also the open call Designathon theme that was led by Rainer, which we collaborated with the systematic review team as well. So firstly, in terms of our systematic review, we define a Designathon as having three kind of phases. So the first part is the preparation phase with end users. The second part is the intense collaboration period, often with teams of diverse members. And these typically last from a few hours to a few days. And there's also, it's been informed by design thinking, and there's involvement of rapid prototyping. So the aim of this systematic review is to systematically collate articles related to Designathons for health, to better understand how they actually conducted, what kind of facilitators and barriers are discussed to successfully conduct the event, look at any evidence for effectiveness and resource use. So our systematic review followed the Cochrane guidance. We looked at the databases, which you can see on the screen, and we included any article that had primary data for a Designathon as I defined it before. So it has to have some kind of an open call to stakeholders to work in teams to design solutions to a health-related problem. And the solution must be somehow evaluated either by a judging panel or the community. So what did we find? Here is the Prisma flowchart. So you can see that we found about over 2,000 records or articles, and eventually included 38 publications in our review. So I'm going to give you an overview of these 38 studies that we included. So firstly, thinking about how were these Designathons conducted. So we can see the vast majority were in person. But interestingly, as COVID happened, we saw Designathons becoming more popular online. It's also observed that in terms of participants, so remember these are all health-related problems. We found that actually 3 out of 4 involve both health and non-health participants. And in terms of the final products for Designathons, about half-half were for ideas or actually an actual prototype. And in terms of whether these ideas or prototypes were further developed, we found evidence that 39% was doing further development, whether running in a trial or actually progressing it towards a product on the market within 12 months. But you can also see that the vast majority of studies we found, it was either unclear or not reported what happened after the Designathon. Here's a bit more information about how the Designathons were actually conducted. So you can see that the median number of participants is about 60, but the interquartile range from 34 to 99. And in terms of the number of teams, so the median number is 8, in the quartile range 5 to 15, and the duration ranges anywhere from 3 hours up to 21 days. And in terms of the number of solutions or products, which we define as ideas or prototypes, the median number was 8, in the quartile range 5 to 13. And the most common set of criteria for the judging of these solutions was around themes of feasibility, about innovation or creativity, and impact. And some examples of the topic areas that we found Designathons were run were related to education, creation of mobile apps, actual medical products, interventions that promote self-care or mental health and well-being, connectivity with health services, and also health interventions such as promotion of HIV self-testing and pre-exposure prophylaxis. So I'm going to share with you some of the themes around facilitators of success, going from the most common to the least common. So firstly, a lot of studies talked about the inclusion of diverse participants, which also included the focus population or the end users. So that was seen as a key to its success. And also the amount and quality of mentoring or coaching for participants. And thirdly, about participants' contextual knowledge and familiarity with the target problem played a role in making this a success. And you can see the rest on the screen there. And in terms of barriers to success, so studies often mentioned about challenges of recruiting the right people, especially trying to get that diverse kind of teams, and also achieving balanced representation across the teams. So configuration of the teams was a challenge, and also how you can kind of effectively collaborate with team members who might hold quite divergent perspectives. Now, some of the strengths of using a Designathon was, again, very similar around the fact that the participants were quite diverse. So that encouraged creativity and innovation. And the kind of end products are kind of end user-led innovations, which is also a key strength of this approach. Studies also mentioned about the opportunities to network, have connections, and future collaborations. So I want to share some of the limitations of our systematic review. So I mentioned that we were trying to look for data around resource use, cost effectiveness kind of studies, and also effectiveness of the prototypes or ideas. But we actually found very limited data on this. We only looked at English-only publications and also acknowledged that there might be other reports of Designathons that were not actually published in our peer-reviewed journals search. But the good thing is that we also collaborated with Rainer and team with the open call, just to make sure that we don't miss any other Designathons. So in conclusion, you can see our review has found Designathons have been used for generating solutions to a wide range of health-related issues. The inclusion of diversity of participants is a key facilitator to success, and this involvement of end users have led to enhanced creativity and also thinking outside the box. Thank you for your attention. I'm very happy to be reached on my Twitter account or my email.
Thanks, Dr. Ong. That was great. Our next part, as Rainer mentioned, we're going to be dividing into small groups, and we're fortunate to have 5 finalists who are going to present a brief description of their Designathon, and then we'll have a little time for questions and answers before we come back to the main room at about 35 past. So if you just hold on and sit tight, and we'll be dividing people groups.
Thanks, Joe. Thanks, Dr. Tucker. So in a moment, you will see 4 breakout rooms appear. You'll only see 4 of them because the 5th one is in this main room. So if you want to stay for the the breakout room that's on the China Designathon by Shimons Yan, you can stay in this room. But right now, you should see all the breakout rooms open. If you click on the bottom, there's a breakout room tab. You can join the room that you want to. So lucky, you head over to the one that has your name on it, Kalichi, Jason, Kelly, respectively as well. And if you need any assistance with joining a room, I can help assign you as well. So please feel free to let me know in the chat. And I see people and folks joining the breakout rooms already. So we will have about 10 minutes in these rooms. So see everyone soon. And Shimons here in this breakout room, or rather this main room, over to you to share more on your Designathon.
Okay, hi everyone. My name is Shimons, and I am just going to share the presentation of my Designathon case. Hi everyone, my name is Shimons Yan. I work as a research assistant at the UNC Project China and have been organizing crowdsourcing events and a SESH organization. Today, I'm very glad to share with you our case of Designathon targeted at men who have sex with men in China living with HIV. I will go through the following parts in today's presentation. HIV partner services require people living with HIV to disclose their HIV status to partners and get them tested for HIV. It has been found effective in new case finding and preventing onward transmission, but the uptake among Chinese MSM is low due to stigma, discrimination, and the lack of tailored services. Therefore, our SESH team organized a Designathon to improve HIV partner testing for them by developing tailored partner services. This Designathon was held in Guangzhou, China in 2020 and was titled Tell You My I, with the I here meaning both love and AIDS in the Chinese language. There were 3 stages in the Designathon. In the preparation stage, we organized a steering committee and invited mentors and judges first. We also invited participants to build up teams by themselves. And then 2 weeks prior to the Designathon, we shared inspirational materials from a previous open call and organized webinars to introduce about the Designathon and answer any questions they have. In a 2-day intense collaboration stage, the participants were required to co-create solutions and deliver prototypes and present their ideas within 48 hours. The final works were evaluated based on feasibility, acceptability, empathy, and impact. And then in the follow-up stage, we collected Designathon feedback from all participants and finalized the intervention plan with the winning team. The intervention were then under evaluation through a pilot randomized controlled trial. I would also like to share some unique aspects of our Designathon. The first was that our teams were built by cities because we wanted to deliver actionable plans for each city. So we had a total of 8 teams from 8 cities, with each team consisting of 5 to 6 participants, including 1 person from local CDC, 1 from MSM serving CBOs, 1 representative of MSM living with HIV, and at least 2 open call participants with design or computational skills. We also made sure to involve our key population in multiple stages, including promotion, representing in steering committee, and mentors and judges. And also we had 1 participating in each team. Since our key population still face a lot of stigma, we also strived to maintain their privacy while we encouraged sharing of photos within the community by allowing the use of an alias and also having everyone to sign an informed consent form to not leak any identity information. Of course, we also encountered some challenges. The first was low motivation to participate. So in addition to connecting with local CBOs, we also provided diversified incentives, such as opportunities to win monetary prizes and also connecting with field experts. The second was how to build an inclusive platform. We used different online and offline venues for promotion to reach a more diverse population. And then the third was to ensure high quality output. We assigned staff to keep track of each team's progress and arranged Q&A sessions with different mentors for each team. At last, the challenge was how to keep the impact long-lasting. We invited participants to involve in the design and implementation of a follow-up pilot RCT. To sum up, this Designathon provided an iterative process to enhance community engagement because it allowed the key population to use their own lived experience to inform the intervention design. This format of Designathon was able to develop high-quality outcomes in a short period because it generated interventions that were acceptable, practical, feasible, and not too costly, that were now under evaluation through a pilot RCT. In conclusion, Designathons can help address health challenges by mobilizing the end users and facilitating cooperation between different stakeholders. At last, I would like to thank the local CDCs, MSM community organizations, all the voluntary mentors and judges, and the SESH staff. of course, our biggest thanks go to the participants from the open call and the Designathon. This study was also part of an R34 project supported by the US National Institute of Health. So that's all. I look forward to any discussions or questions, and thank you for listening. Okay, so that is the end of my presentation. And if anyone has any comments or questions, just feel free to ask. And you can unmute yourself or just type in the discussion chat box.
All right, maybe I'll have one question then.
Okay.
Shimon, thank you so much for the presentation. I'm just wondering, was it difficult to recruit, participants? You mentioned that there was stigma, so like, especially in the local setting, were there special like techniques or strategies that you thought were especially helpful?
Right. So actually, it's quite difficult to recruit participants, especially those representing our key population. But we did build connections with a local community-based organization that were serving people living with HIV. And also we had a connection with a key opinion leader who has always been like voicing out the rights and advocacy for our key population. So we reached out to the community organization and also to that key opinion leader for their help. And also because our team was built up like in a collaboration with CDCs, and CDCs basically serve those people living with HIV. So they did have some like relationships and connections with people who would voluntarily agree to participate in our Designathon.
All right, thank you so much.
Hi, Shimons. Thank you for your presentation. My question is basically about how you actually formed the groups. Were the participants allowed to form a group based on where they live, or did you have to do a random grouping and then tell them who their group members are? Like, if we want to replicate this, what are some of the things to consider when you want to group the participant? Thank you.
That's a really good question. So actually, since our teams were like formed by cities, we first reached out to like CDCs in that specific city for them to like ask for different team members to join. And then since we also have participants from the previous open call, we sent out surveys to the open call participants to ask like about their willingness to join each team and their preferences. And then we just allocate by like their preferences and also by the vacant spots that are available. And I think mostly that were based on like cities or their locations, but also when participants specifically want to join a team that represents a certain city, they are free to go there.
Okay, thank you.
Thanks for the question.
So we have another 50 seconds for a quick question.
Right. Or like any comments.
Sorry, in terms of participant diversity, was there any sort of like age diversity, or did you have like any specific inclusion criteria that helped streamline who can be part of the groups?
So our eligibility criteria only required people like older than 18, they were free to join. But like in the final demographics, most people were younger, and I think the average population age would be like 30 years old or so. So I do think that we need to include like an older population in the future, like by having some more reach out activities.
Yeah, I was thinking that could probably be a problem for the older generation. Thank you.
Right. Thanks.
Thanks, everyone. This was great. And I apologize for the brevity of the presentations, but feel free to reach out to these, the presenters for more information. And each of the case studies that they presented are actually in the draft practical guide. Our next speaker is Dr. Wei-Ming Tang, and he's going to present the draft practical guide on Designathons. Over to you, Wei-Ming.
Thank you, Joe. Thanks for everyone for joining today's practical guide meeting. This practical guide is really a joint work of everyone here. Oh, sorry, my Wi-Fi is auto playing. So, everyone already introduce a bit about what is Designathon, how we actually conduct Designathon. In order to facilitate the use of Designathon, our group SESH collaborated with SIHI, Hope Network, and TDR and developed this practical guide. And this practical guide will be available in this year. We'll launch it at the ISS-TDR meeting at Chicago in July 23rd. So in this practical guide, we have several sections. One of the sections is rationale for Designathon. So we already hear about the definitions of Designathon, how to conduct a Designathon, but why do we need a Designathon? There are many health inequality issues, and curbing these health inequality issues require tools that engage people. And however, the existing approaches are often top-down, led by health professionals, use disease-based approaches, and the limitation of community engagement is obvious. So we need bottom-up strategies to solve these problems. And Designathon provide an opportunity for end users to be more actively involved across the entire process of the Designathon, in order to develop interventions or develop services for the local people. Health Designathon allow community members and other key stakeholders to work as partners and leaders to address health issues together. This is a structure of the Health Designathon. Joseph already introduced it. I will not go detail, but in this practical guide, we also summarize some risk and risk mitigation strategies of the Designathon. When we conduct Designathon, we often have a risk of appropriate numbers of participants, too few end users with lived experience, difficulty building inclusive network, and lacking community representations, and bias judging, lack of fairness and transparency, limited regularization of all participants. In this practical guide, we provide some suggestions regarding how to do the risk mitigation. Since the time limit, I will not go in detail here, but we would like to share the full version of the Designathon practical guide with you later on in July. So in this practical guide, we also mentioned how we are actually doing the monitoring and the evaluation. Monitoring and evaluation are important pieces in order to ensure the success of the program. We summarize that we can conduct case studies, qualitative measures, clinical trials, dissemination and implementation research to monitoring and do the evaluation. For the case studies, either qualitative and quantitative measures can be used to summarize the Designathon outputs. And in the qualitative measures, we can conduct semi-structured interviews, focus group discussion, co-creation groups, mixed measure research, and other relevant qualitative measures to summarize the key things or outputs from each Designathon process. And in the clinical trial, the intervention, products, or outputs developed at the Designathon process can be evaluated through randomized RCTs or quasi-experimental studies or other trials in order to see whether the intervention or products we developed through Designathon is effective. We also want to disseminate and implement the outputs from the Designathon. This also should be remembered that a key part of the Designathon. So when we start to prepare for a Designathon, there are several things need to consideration. We need the community support, we need the human personal resource, we need a venue network, and we also need the funding support. for the community support, we need to, in order to engage people, especially the local people or the people with experience, we want to engaging them as key stakeholders. Also, we want to sometimes we want to work with the local community-based organizations to help them contribute. For the human personnel, we need to administrative people to assist them with communication and coordination. We need the steering committee members, mentors, judges, facilitators, and participants to contribute. For the offline event or virtual event or hybrid model Designathon, we usually need an open space or multiple separate rooms for different teams to contribute. They will work together in separate rooms for between 2 hours or 72 hours. They were working together in a private space to discuss their team plan, and eventually they can present their plan later on. Of course, we also need the funding support for the accommodations, travel, and supplies. In the Designathon practical guide, we also summarized the different advantages and disadvantages of virtual, in-person, and hybrid model. Since we are in the later part of this meeting, we'll have a discussion with each of the cases we included before. We'll go back to this part later on. And in this practical guide, we also summarize them open resources that can be used in the future for people who want to use Designathon for their research. This including our previously published cross-sourcing practical guide, the joint consensus statement of cross-sourcing challenge contest, hub cross-sourcing workshop series, and also W and TDR global guide on public engagement and crowdfunding. This practical guide is really a joint contribution of many people. I summarized some over here. We would like to summarize to thank the people from the Open Costing Committee. We also summarize the Designathon Open Organizing Committee, and also we thank the people in the Designathon Systematic Review Committee. I think this is a brief summary of the Designathon practical guide, and we can share with you the full practical guide later on after the Chicago meeting. Thank you.
Thanks, Wei Ming. That was a great summary and sort of sneak peek. And now we're going to have a panel discussion with the same 5 finalists, moderated by Dr. Tan and Dr. Tang. So over to you.
All right. Thank you, Dr. Tucker. So right now, I'd just like to jump into the panel discussion, invite our panelists. So the panelists are the representatives from the 5 teams, the top scoring submissions. So we've got some brief introductions for them. So I am just slowly adding them to the spotlight so all of you can see all of them in a really nice panel over here. Once Dr. Kelechi does the same, I'll be able to add that spotlight as well. But brief introductions. Dr. Kelechi Chima is a project facilitator for the 4 Youth by Youth Designathon in Nigeria, and is a 2023 West African Rhodes Scholar. So Ms. Lucky Princia Muchowika is a youth leader, biostatistician, and epidemiologist from Kenya. Dr. Jason Ong is an associate professor at the University of Melbourne and at the London School of Hygiene and Tropical Medicine. Dr. Kelly Schmicki is an assistant professor at the University of Health Sciences and Pharmacy in St. Louis. And Ms. Shimon Yen is a research assistant at SESH and also an incoming PhD student at UCLA. So let us get a ball rolling with some questions. Over to you, Dr. Tang, to kick us off with our first question.
Thank you, Rainer. Thanks for the introduction, and really appreciate for all the panelists to join today's session. First of all, I would like to ask some questions regarding engaging the community. You all know that for the Designathon, we really need to engage the community because it's a co-creation process. So in your past, what are some tips you have been used in your Designathon? Well, is there any innovative strategies you would like to share with us? Since there are 5 panelists, I would like to go one by one, probably. Lucky, sorry, you can go first.
All right, thank you so much for the opportunity. So to respond to your question, one of the strategies that we have seen work in terms of engaging the community is really to get down to their level. And so keep it as open as possible, but obviously have guiding themes so that the problems that the community is going to bring up with is exactly what we'll try and follow up, as opposed to have already a set, I would say, context of what it is that we want to tackle. For example, let's say if we are interested in working with around HIV and we want to do a project around PrEP, taking a step back and asking that question and letting the youth and the community themselves point us in the direction in which they believe we should support them. And so that is one of the strategies that we've seen work, getting the voice from the youth and then working with them as we work towards those implementation projects.
Thank you. Katie, would you like to go?
Sure, I think I'd say two things. What is your end goal? Know where you want to get to in the end. You won't know exactly what that'll look like, but you should have an end goal in mind. And based on that, there are groups that can contribute to what that end goal will look like. And you want diverse groups. You don't want huge numbers. You want representative samples from those groups. Now, representative here is more like qualitative research representative than quantitative research representative. Crowdsourcing should not be mob rule sourcing. So you can do this with smaller numbers of strategically selected people. Okay, that's all.
Thank you, Katie. Jason, would you like to introduce your ideas?
Yeah, so mine was reaching a sexual minority group, so overseas born gay bisexual men. So I guess my tip is to involve them from the very start. So we had people part from that focus population in our research design team, and the other tip is to value their time as well. So I actually paid them to join and to participate rather than just being a volunteer. So they were equal partners from the very start to the end. So by the time we reached a Designathon stage, it was very easy to recruit people because we're already in their networks and they can kind of tell others in the network about the Designathon. Thanks.
Basically, start from the beginning by involving them as the first step of the Designathon. Shimon, what's your experience?
So in our case, we were trying to reach out to people living with HIV. So they actually face a lot of stigma, and I also talked briefly in the breakout room. I think the most important thing is to identify the venues that were mostly easy to reach to them. For example, in our case, we just reached to local CDCs and key opinion leaders because with the collaboration and the trust and their relationship building, those people living with HIV would agree to participate and also give back to their communities. But with us alone, trying to reach out to them, they might be suspicious about our aims.
So basically work with CBO, also build trust. And thank you. Knich, I know you cannot turn your camera on. Can you speak up regarding your experience?
Yes, definitely. Thank you so much. Sorry, I'm having issues with my camera right now. But with us, we were targeting young people aged 14 to 24. And so our strategy was really based on understanding their context and reaching out to them through the appropriate means of communication that was relevant to them, and then also providing a face where they could feel comfortable. We had youth ambassadors that were within that age range who also helped with reaching them, and we're also part of the facilitation process during the Designathon to really give it that young air and give it that atmosphere. Thank you.
Thank you. Basically, you want to understand the context, also use the youth ambassadors. All right. Thank you. Rainer?
All right. Thank you so much, everyone, for the wonderful responses. So one thing that we have seen in terms of the practical guide and the experience of Designathon organizers is that, some folks choose to do like online Designathon, some folks choose to do offline Designathon, some are hybrid. You've also have a Designathons, all of you over a variety of platforms. And I wanted to find out, what were some advantages or disadvantages of like the respective approaches. And, maybe I will start with Lucky. To my knowledge, we also was more of an in-person Designathon, was that right? And did you have any like advantages or disadvantages of having it in person, you think?
Yes. So ours was most of the part was happen in person, and the main advantage I could say was the ripple effect. So there were those who took part in the open call and then were able to pitch, but even the young people that were around and that witnessed that in-person effect were very much encouraged and would actually be looking out for more open calls and wish they knew about this a bit sooner. So there was a bit of a ripple effect because this was a community of young students, university students, and so we saw the enthusiasm and the understanding of the importance of such spaces. But I'll give Michael, my colleague, an opportunity to maybe also add something in terms of what were some of the disadvantages as well that we saw.
Thank you for that. When it comes to the different methods on how we held now the Designathons or hackathons, from how we looked at it, it's best to go with the physical method. Just as Princess said, there was a lot of a great ripple effect on the people that actually attended. But also there was the aspect of getting feedback directly from the judges, from the people that actually went ahead to present their ideas. And on top of that, the one thing that we want to empower the guys that are now presenting is the fact that you are focused on community. So start community, finish with community. One thing that maybe I'll say with the disadvantages is obviously the logistics. Logistics is always going to be a challenge, but at the end, the goal is actually to impact the community, and I think that went well with the physical. Thank you.
Right. Thank you so much, Lucky and Michael. So, we've got just a couple of minutes left, and I wanted to turn the attention now to Kelly, Jason, or Shimon. I believe you, on the other hand, had, more intense Designathon activities online. So, for maybe Kelly, would you like to start first on reflecting, what were some advantages or disadvantages of that?
So I've done a Designathon in person and online. I think the most important thing about a Designathon is getting people to attend. During COVID-19, it was obviously impossible to get people to attend in person due to physical distancing requirements, legal requirements. So online was the only way to go. Also, in that event, I was interested in all of England. So I wasn't going to get representatives from all of England in one room easily if we had to bring them all down to London, which is where it would have been hosted. The other design I did was a more professional community. And the only way we were going to get hospital execs to attend is if we shished up the day. And it was before COVID. So that was held at the Shard in London and had funding from the Health Foundation. So getting participants in the room, how can you get them there? That will designate the venue you're using, including online venues. The second thing I would say is the scope again. If you need more ideating, more free space, more going back and forth, then in person is naturally a bit easier than online. If you're more focused, then online can probably carry the day for you. But each Designathon's got its own thing.
Thank you so much, Kelly. How about you, Jason? Would you like to weigh in on that as well?
Yeah, so ours was online, and we had participants from the UK and Australia. So actually, Kelly was part of this Nudgeathon as well. I think the main advantage is obviously convenience. So people could just dial in from wherever they were. It was much cheaper than flying Kelly and other colleagues from the UK to Australia. And also we could get a variety of people join. So graphic designers and clinicians, researchers, and the focus population. I think the main disadvantage for us was because of the difference in geography, the time zone difference. So it was really early for Kelly and really late for us in Australia. So that was a challenge. And as Kelly mentioned, there is something about getting together and seeing people face to face. So we lost a little bit of that online. But because we were very focused and we wanted a campaign image, I think that worked for us online. Thanks.
Thank you. And with a real quick one, we've got a few minutes left. Shimon, how about you? How about your Designathon?
So actually, I have similar experience with Kelly because I've been through like both online and in-person Designathons as well. So I think I agree with Kelly and Jason's point that online Designathons could be low cost and very convenient for people to attend. But I do think that in addition to all the advantages that they've mentioned for the in-person Designathon, I would also want to add one point of like for in-person Designathons, not only there is not only within team collaboration, but also like between team collaboration. Like each team would approach to other teams to like facilitate and get inspired by their ideas, and potentially they could work out for like a more comprehensive, a more combined intervention idea. And I think that definitely facilitates participation.
That's really powerful and interesting. And we've got some time. Kelechi, 1 minute. Would you like to share anything else regarding your Designathon?
Yes, thank you very much. So our Designathon was an in-person Designathon, even though I've participated in online Designathons as well. And the real thing is the atmosphere. And when you provide a conducive environment and you take out other distractions, it really allows people to hone down and focus. And so for that 72-hour period, that's their one goal and their one target. And I think a lot of great ideas and a lot of creative ideas can come out from that high pressure moment. Thank you.
Thank you. And thank you to all the panelists. Congratulations on the successful Designathons and for your participation in this open call. And yeah, round of applause from everyone for all of you here. Let me pass the time back to Joe, who will wrap up this session. And thanks to Dr. Tang as well for moderating the session too.
Thank you, everyone.
Thanks, guys. That was great. And just in terms of wrapping up, I'd like to thank our funders. Special thanks to TDR, to CETA, to the US NIH, to all of the funders, and to SIHI, to the Project Hope Network, and to SESH. Special thanks to Jason and Nita and the team that's leading the systematic review, and to Rainer and Yusuf, who are co-leading the open call. This is really a team effort, and we're really fortunate to have a fantastic team. Rainer has put an evaluation link into the chat box, and please take a couple minutes to complete this. This is helpful for us because, as several folks mentioned, we're going to be meeting in person in Chicago in a week and a half, and we'll be doing some in-person kind of finalization of the practical guide. It'll be engaging, and this is really sort of a stepping stone to that in-person meeting. So thanks again to our finalists and everyone who joined us today. And if anyone would like to stick around afterwards to chat with other participants, feel free to stay on the call. But this is the end of the scheduled bit. So thanks, everyone.
Thank you, everyone.
Thank you, everyone. We'll share the practical guide with you later on.
Thank you.